Hi, everyone. So I found this article from The Guardian, and it's basically talking about how Latinos are disproportionately being hit by the coronavirus. And I have two other articles that I'm going to just leave in the description box that are kind of talking about similar things. And it's just, there's different news reports basically coming out saying that we are actually the hardest hit group in the country so far. So I thought that I would touch on that. So, as you can see, the virus doesn't discriminate, but governments do. Latinos disproportionately hit by coronavirus. In some areas of the U.S., COVID-19 is killing Latinos up to 3 times the rate that it's killing white people, even as they are among the least able to access care. Latinos across the U.S. are disproportionately getting sick from coronavirus, in some regions being infected and hospitalized at up to 3 times the rate of white Americans. And the Latino communities that are worst hit by the crisis are among the least able to access the healthcare systems and unemployment benefits that could bring relief. New data trickling out of cities and states are making increasingly clear the virus's unequal toll on minorities. In New York City, data has shown that COVID-19 is killing Latino people at 1.6 times the rate that it is killing white people. In Utah, Latinos are being infected and hospitalized at 3 times the rate of white people, whereas Latinos make up 14% of the state's population. 29% of the patients who tested positive for COVID-19 in the state identified as Latino. In Oregon, Latinos accounted for 22% of coronavirus cases, where demographic information was available. Latinos make up 13% of Oregon's population. In New Jersey, Latinos make up 19% of the population, but nearly 30% of COVID-19 patients in that state identified as Hispanic. In Washington state, 25% of those infected are Latino, while they make up only 13% of the state's total population. Several states have not reported the racial breakdown of confirmed cases, and those that have are often offering limited and preliminary numbers, but the figures are not universally bleak. In some states, including California, the infection and death rates appear comparatively low for Latinos. Though Latinos make up 39% of California's population, they account for 30% of COVID-19 deaths. Still, public health experts warn that the official statistics may be underestimating the virus's toll on Latinos communities, wary of seeking medical care due to a lack of health insurance, and in many cases fear that going to a hospital will expose them to immigration authorities. I would put lots of grains of salt on these figures, said David Hayes Bautista, who directs the Center for the Study of Latino Health and Culture at the UCLA School of Medicine. Think about who had access to the testing and who's getting into the hospitals. The disparities boil down to differences not only in race, but also in income and access, Hayes Bautista said. The problems aren't genetic, he noted. They are structural. Economic disparities, health vulnerabilities. With the exception of diabetes, Latinos on average have lower rates of heart disease, cancer, hypertension, and other underlying conditions that make people especially vulnerable to COVID-19, Hayes Bautista noted. But Latinos make up a large proportion of what is now considered the essential workforce of grocery store staff, restaurant workers, caretakers, cleaners, and delivery workers, and are putting themselves at the front lines of the pandemic. Christian Zamaron, whose family is from Mexico, works part-time in an Amazon warehouse in Chicago where he makes $15 an hour. Amazon promised workers an extra $2 an hour for working during the pandemic. But his part-time colleagues, Zamaron doesn't get health insurance. Instead, Amazon provides $9 extra a week in health pay that can go towards health care costs. My bills haven't stopped, so I have to keep paying, Zamaron said. I need the money, but I'm there to speak up for my coworkers. A lot of the stuff that we're moving isn't even essential goods. This is reckless endangerment of their lives. For many Latinos, the economic fallout from the pandemic is just as worrying as the health risks, leaving many with little choice but to risk their lives at frontline jobs. But unemployment has also disproportionately affected Latinos. Compared to the overall U.S. population, Latinos disproportionately say they or someone in their household has taken a pay cut, lost a job, or both since the pandemic hit, according to a recent report from the Pew Research Center. For Rafaela Berry and her mom, Brazilian immigrants now living in Atlanta, coronavirus is already slashing income. Berry works as a nanny in the past, has helped her mom clean houses. In recent weeks, more and more of their clients have canceled cleaning, she said, either because they've been laid off or out of concern that a visitor could bring the virus into the house. They used to clean 4 or 5 houses a day. Now there's one house to clean every 4 days. To get by, Berry's mom began selling $5 masks she sold herself. For Berry, it's impossible to separate the health risks from the economic toll the virus could take. The sickness is scary, but not so much for the health risks, she said. If one of us gets sick and goes to the hospital, we'll have medical bills, but we also won't be able to make money to pay them off. With economic disparities layered upon health disparities, the Latino workers who most need access to health insurance and government benefits are least able to access it. Latinos have the highest uninsured rate of any racial or ethnic group in the U.S., and only 38% of Latinos working low-wage jobs have access to health coverage, according to a report from Mi Gente and the Labor Council for Latin American Advancement, published Thursday. Governments discriminate. Moreover, the Trump administration policies discouraging Latino immigrants from making use of public health insurance and government benefits such as food stamps, as well as the continuation of immigration enforcement, even as COVID-19 spread through the country, has ratcheted up the fear that asking for assistance could land them on the radar for immigration officials or even separate them from their children. And Massachusetts, General and Boston medical staff are trying to hammer the message in our Latino communities that it's safe to get tested, it's safe to get care, said Dr. Joseph Vantercourt, the Vice President and Chief Equity and Inclusion Officer at the hospital. But of course, there's still mistrust. Of course, people are hesitant. And despite the hesitance to get care, it's clear that Latinos are being disproportionately infected, Vantercourt noted. They make up 35 to 40% of coronavirus patients each week. That is high, even though normally only about 9% of the patients at Mass General are Latino. Wow. So basically, they're saying that normally they just, out of every other time during the years, it's usually only 9% of the patients that come in there are 9%. But now, because of this virus, it's 35 to 40% that they're seeing that many Latinos going into their hospital. That's a lot. That's crazy. The last 4 years have been very, very, very heavy, said Luis Gallegos, director of the TODEC Legal Center in California's Coachella Valley. Gallegos, whose uncle died on 31st of March, complications from COVID-19, said for a community that has been overwhelmed with attacks from the government every day with every tweet, the coronavirus is just adding to our trauma. Gallegos hasn't been able to properly mourn her uncle's death, not only because she and her family weren't able to hold him and comfort him in his last moments, or to see his body after he died, but also she has been working nonstop to help anxious community members who are calling into TODEC's hotline at 3, 4, even 5 in the morning, she said. When we answer the calls, we don't know if it's going to be okay, but we're trying to lift their spirits anyway. Latinos make up almost 3/4 of the estimated 10.5 million undocumented people living in the U.S. Although they commonly have taxes deducted from paychecks, undocumented people typically cannot benefit from unemployment assistance, nor will they see that stimulus checks of up to $1,200 that many Americans will receive. The virus doesn't discriminate, but governments do, said Leticia Casalido, an undocumented immigrant from Honduras living in New Orleans who has spent recent weeks delivering food to immigrant families as part of her organizing role with the nonprofit Familias Unidas en Acción. Unfortunately, people don't see us as worth saving, Casito said in Spanish. The good thing about the undocumented community is that we're used to creating our own reality and finding ways to take care of each other. Advocates urging lawmakers to step in and have made some headway. This week, California Governor Gavin Newsom announced $125 million in relief to the state's undocumented residents, while leaders in Chicago and New York City have created relief programs for immigrants and refugees. California alone promises help statewide. Every Californian, including our undocumented neighbors and friends, should know that California is here to support them during this crisis, Newsom said when he announced the policy. But the aid, which will provide 1,000 to about 150,000 families, will reach only a fraction of the estimated 2 million undocumented immigrants living in California. This is obviously a historic development, said Christian Arana, policy director of the Latino Community Foundation in San Francisco. But $125 million is just a drop in the bucket in terms of need, he said, adding that 1,000 won't cover a month of rent in many areas for the state. That is true. Liliana Garcia Ruiz, program manager at Nuestra Casa, a social service agency in California's Bay Area, said the need is stretching their food bank program and that the demand has doubled since the outbreak started. We're probably most fearful of the repercussions for the future and how families are going to recover, said Garcia Ruiz, with many of the agency clients burning through their modest savings to eat and pay bills in one of the nation's most expensive regions. Still, despite all the pain, Terex Gallegos, she said she sees the crisis as a sign of God. Our immigrant community, our undocumented community has always been essential, she said. Now it's time for all of us, our governments and lawmakers, to show compassion and take care of the communities that have put themselves on this line. Basically, that's one of the articles here. And then here's another one. And this one is from USA Today. And it's basically talking about Latinos disproportionately dying, losing jobs because of the coronavirus, and something has to change. And it's basically talking about how in different states, similar, there's all of these different high percentages in the different states of Latinos who are becoming sick with the virus and who are dying from the virus as well. So this is another article here, and then another one is this one. And Anon and Light Skin Motivation actually sent this to me a few days ago, and it's racial disparities and the pandemic, looking past the rhetoric of racism. And this one is really good because it kind of sheds a light on basically what we've been hearing in the media with regards to who or which groups are being affected by the virus more than others. So this is a really good article as well. And I'm going to post the links to all of them in the description box. But I figured that I would share that with you all. Again, I hope that you're all safe and well and taking care of yourselves. Please take this seriously. I feel like in parts, like if it's New York City, it's like it seems like people are taking it seriously. But other parts, it's like sometimes when we go out and about, it seems like there's still people out here that aren't taking it that seriously. So, just be careful and take care of yourselves. And I guess I will see you all in my next video. Bye.